Hi, everyone. Welcome to the Northeast Region WOCN Virtual Conference. I'm Bill with Rooke Products, and via this YouTube live session, I'm going to quickly show you our family of Rooke products, and then we're going to chat about how they can really help your patients and you. Since we're live, you can also message me in real time as well. And please also feel free to email, call, or text me for any follow-ups that you might have. And we also have a lot of great information and clinicals available to you on our virtual booth for the meeting too. So with that being said, let's get started first with our Rooke vascular boot. So the Rooke boot has been successfully used by surgeons and interventionalists and wound care for over 30 years. Rooke boots totally offload the patient's heel, and what really sets us apart is that we provide natural warmth, which helps produce a vasodilatory cascade and a significant boost in regional distal perfusion, providing a significant, it's just absolutely great for that. Our Mayo Clinic study also demonstrated a 5.3 millimeters of mercury increase in TCPO2s with Rooke vascular boots. Now, I've learned that 30 to 40 millimeters of mercury measurement in TCPO2s is needed to properly heal a wound. So that 5.3 millimeters of mercury increase is a significant percentage of that 30 to 40 that you need, roughly 13 to 17%. And Rooke boots are an easy, non-invasive way to get a big chunk of that needed TCPO2 right out of the gate. So Rooke boots are one size fits most. They can be worn on the left or the right side. They have a grippy bottom to help with ambulation, and there are numerous cutouts and a buttonhole opening to run like vac lines, SCD tubes, and whatnot. And there's also an anti-rotation wedge that you can put on either side to keep everything lined up the way you need to. This is really cool. We have adjustable wings on the boots. So think about your foot drop prevention patients. By adjusting the wings, you do a very nice job of preventing that foot drop. It's not going to correct existing foot drop, but think about the patient that you're going to have immobile in bed for 3 or more days potentially. Put a pair of Rooke boots on them. That's going to do a very nice job of preventing that foot drop. So, next thing, so we're going to go over a couple indications for use. And to make sure I stay on point, I'm going to make sure that I look at my notes here, because these are really cool, great indications for you. So your patients that are going to be on vasopressors, excellent for Rooke boots. ECMO patients, IABPs, your post-BKA contralateral foot, your post-op open and endo revascularization, arterial thrombolytics, and then of course for the prevention of your heel ulcers and foot drop. Also, I want you to think about that patient that has the cold mottled foot, non-blanchable heels and toes. Another big one, diabetic neuropathy, very good for that. Your existing pressure ulcers, of course, lower extremity ischemic wounds, spinal cord injuries, and therapeutic hypothermia. It's really a good system for all of those indicators for use. So if you recall, I mentioned Rooke boots are great for patients on vasopressors, and especially the ECMO patient. We know that the ECMO patients have a very fragile profile regarding their skin integrity around the distal extremities and around that distal point of the Achilles, specifically there. So as I mentioned, Rooke boots totally offload the heel. They protect and naturally warm the lower extremities, providing a significant boost in regional distal perfusion. The Cleveland Clinic, the Mayo Clinic, and Abbott Medical Center successfully use Rooke boots with their ECMO patients, and available data from Abbott shows that ECMO patients wearing the Rooke boots had only a 0.0068 skin breakdown rate, and that was one patient out of 145, and that was a stage 1 at the Achilles. So Rooke boots are truly fantastic at reducing the risk of skin breakdown for your ECMO patients on vasopressors and those other indications that we talked about. Another supporting clinical study from Riddle Memorial Hospital, D. Foster, out of 50 patients and 100 limbs in the ICU with an inclusion criterion of a Braden score of 14 or below, a PAD diagnosis, patient on vasopressors, an existing arterial pressure ulcer anywhere, and an albumin level below 3. So these patients were certainly not cream puffs. We had a lot going on there with these folks. So these 50 patients that wore Rooke boots for the study had a 0% incidence of heel-toe ulcers. Those patients with existing pressure ulcers, 66% of the stage 1s healed in 4 days, and the rest did by 12 days. And then 40% of the stage 2s healed in 9 days, and then all the rest showed a marked improvement. And then of the 3 stage 3s and the 1 stage 4 in the study, pressure ulcer size was reduced by 75% within 12 days. So all of the clinicians in that study attribute the success of these wonderful patient outcomes to, well, first off, the excellent care given by the staff, but also the use of Rooke boots. So we have a tremendous amount of clinical-based evidence and outcomes to very strongly recommend Rooke boots be a major component in your standard of care. So next I'd like to show you our Rooke vascular mitt. So it also uses a soft padded synthetic fleece material, and it's great at naturally warming and protecting the hands and the fingers, and it also boosts regional distal perfusion. You notice that I can open up the mitt too, so after it's on the patient, if you need to open it up and check, maybe adjust arterial lines or check on the condition of the skin, it's very manageable to do that like that. The Rooke mitt is great for patients with Raynaud syndrome. It's great for patients that are on vasopressors, of course, patients with mild to moderate AV access steel, hand ischemia, scleroderma, and then also digit reattachment too. So our next product to show you, this is our Rooke below the knee amputation BKA stump protector. The Rooke BK is a padded, soft interface device. It has a rigid back, and it is used primarily to protect the post-op BK wound site against a bump or a fall. So we have had 29 reported falls of patients wearing the device on their BK wound site after falling with no dehiscence at all. So 29 with 0 issues of dehiscence. We love that. That is so cool. And also, this is great for contracture control with that rigid back. And it also helps, again, with the natural warming, boost perfusion for your patient too. So another thing to talk about, I think a lot of you may have had experience with your BK patients using a generic knee immobilizer product. So I've been told by wound care that it's not uncommon to see some skin breakdown around the patella area. So very relevant to your practice. Knowing that and keeping that in mind with the design of our product, we have a very soft padded area that goes over our patella, does a nice job of keeping everything in place without putting too much pressure. And we protect that skin integrity there at the patella. So this also comes with a waist belt suspension system to keep everything in place once physical therapy starts as well too. Just a great, fantastic product. I really love this. And then of course, that's going to lead us to our final product. This is our Rooke AK above the knee amputation stump protector. So it's similar to the BK. It's going to do a nice job of protecting against a bump or a fall. It's one size fits most, and you can use this on the left or the right side. It also comes with a belt suspension system that you can use to keep everything in place. And again, that synthetic fleece material does such a nice job of warming the patient, and you get that significant boost in regional distal perfusion there. But again, such a nice job of protecting the skin integrity there. So keep that in mind as well. And so that's just about it for our live session. I wanted to thank you very much for this opportunity to chat with you. Boy, I sure miss our times where I can be there in person and we can talk. I have a lot of pro tips as far as in-servicing that I would like to share with you if you are able to bring our products into your fold. But anyway, I am available the rest of this weekend. If you want to call me, you can text me, you can email me. Here's my contact information, high-tech info board here. Bill at rookeproducts.com. That's Bill at ROOKE products.com. And my cell number is 614-937-7165. You can call me, you can text me. If you get my voicemail, I'm probably talking with somebody else. Just leave a message of when's a good time to call you back, and we'll certainly do that. And again, please remember that we have a lot of product literature. Our clinicals are on our virtual booth. There's also a request for a sample, anything like that that you need to. But again, you can chat me in live time right now if you'd like, or certainly later, and I'll be looking forward to connecting with you. So thanks again. That concludes my session, and I really appreciate you, and I hope you have a great time this weekend.